Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out at the Westgate Center, which has the Jobbing.com arena along with a lot of restaurants and nightclubs, movie theaters. There's residential around here. It's right behind the Arizona Cardinals Stadium. It was built 10 years ago at a cost of $180 million, and it was named Glendale Arena, which was changed in 2006 to Jobbing.com at a 10-year, $30 million naming rights agreement. The arena seats 17,000 to 19,000 people and hosts about 225 musical and sporting events annually, so it's very busy. The topic for today is spinal cord stimulators and the latest research. A spinal cord stimulator can be a very effective last resort for pain management in America. If you have failed back surgery, if you have a successful back surgery that went bad, such as if scar tissue developed around the nerve roots that were freed up, that's called post-laminectomy syndrome or arachnoiditis. There may not be a good treatment option for you with medication, or another surgery might not be indicated. So what do? Well, injections may help somewhat, or like I said, medications, or maybe Lyrica or Neurontin. But at a certain point, a patient is going to be left with substantial chronic pain. It can be disabling, it can cause depression, and if you're on chronic narcotics a lot, that can cause tolerance and addiction and things like that. So a spinal cord stimulator can be a great option. It doesn't fix anything. It can mask the perception of pain. It can replace pain in an area with a tingling sensation that is not bothersome to patients. Studies for years have shown that spinal cord stimulators can be about 62% overall effective, which is great for patients who have no other option. And what do I mean by that? Well, effectiveness means it helps 50% of a patient's back or leg pain, or whatever's bothering them. That is what denotes effectiveness, 50%. So then when you look at the recent study, which just came out, which showed that if a spinal cord stimulator is put in within 2 years of the patient having a chronic pain issue, the effectiveness goes up to 85%. That's awesome. If it's between 2 and 5 years, the effectiveness drops to 68%. So you're still above that overall number. If it's over 5 years, you can still get about a 50% effectiveness rate of 50% or more pain relief. So any way you look at it, with chronic pain that's not as chronic, you still get a lot of effectiveness. How does it work? There's two pieces to a spinal cord stimulator. There's the battery part, which kind of looks about the size of a small hockey puck, which is appropriate because we're at a hockey arena. And then there's the leads that come out of it. So the hockey puck is the battery, and that sits under the skin subcutaneously, either under the abdomen area, off to the side, or above the buttock region. So when you sit on it, it's not in the butt area, it's above it. And then the leads come out of it and they go into the spinal cord area right above it and put electrical impulses right over the cord and the nerve roots coming off. So that can give intense relief of pain. There's a new method now where you also have a lead that goes in the subcutaneous tissue, say in your back, for instance, so you get back pain relief and you get the leg pain relief. That's the problem. Okay, so there's new methods there as well. Most patients get a trial before they get the final implant. The trial actually is a catheter that goes in and the battery pack sits on your belt. Patients wear that for 5 to 7 days. If it's more than 50% effective, insurance will typically approve that, and then they have to get a psychological evaluation for most insurance companies, and then you can get the final implant put in. There are some small risks associated with spinal cord stimulators, such as infection, maybe some bleeding. The leads can shift. Sometimes the patient can get a shock from the battery misfunctioning, things like that. Overall, it has a fairly low risk profile. It's done as an outpatient. There's more information on our website at preferredpaincenter.com. Very active blog, a lot of education on the pages. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.